Hi, my name is Emily Thurlow, and I am representing Regis College in Massachusetts. I'm here to talk today about the Senate Bill 1567, which is Nurse Staffing Standards for Patient Safety and Quality Care Act of 2021. I live and work in Michigan as a registered nurse. The first 4 years of my nursing career, I worked on an OB unit in a hospital. I considered this to be my dream job. This is where I always wanted to be. Women's health OB is my passion, and I was so excited when I got that position right out of nursing school. However, very recently, due to stress and burnout from concerns with staffing on the unit, I left my position there and started a position working in an OB office instead while I finished my schooling. So Senate Bill 1567 is an amendment that was added onto the Public Health Service Act that was already in place. And this would require hospitals to implement staffing plans to allow for appropriate staffing to improve patient safety. This bill would require hospitals to implement these staffing plans within 2 years of the bill being enacted. And hospitals would have to follow the staffing ratios that are outlined in the bill. Some examples of the proposed staffing ratios would include for each nurse to have 4 patients in medical surgical units, 5 patients in rehabilitation units, and 6 patients or 3 couplets in a postpartum or well baby care unit. Other aspects of this bill include that a hospital would be unable to assign a nurse to work in a hospital unit unless that nurse has received orientation in that unit and is able to provide competent care to that patient population. So nurses would be unable to be pulled to other units where they are unfamiliar with working with those patient populations. A hospital would not be able to impose mandatory overtime to meet the hospital staffing requirements. One area of exception was noted in this bill for these requirements, and it was stated that during a state of emergency, a hospital is able to apply an exception to staffing ratios as long as they have exhausted all efforts to maintain required staffing levels, and they are expected to provide a high level of emergency services at that time. Also, as a part of this bill, hospitals will be able to take into consideration the acuity level and nursing care plans for a particular shift, anticipated admissions, discharges, and transfers for that shift, and any specialized experiences required by the nurses for those patients. These staffing plans are to be recorded and reviewed annually and made available to staff and the public. So I am here today to speak in favor of this bill as it stands with no changes. As I have personally experienced working in the hospital environment as a nurse, poor staffing and high patient to nurse ratios lead to high levels of stress and burnout of nurses. This in turn affects patient care and overall health outcomes. Issues with staffing ratios have been an ongoing concern and have only been made worse by the COVID-19 pandemic. Evidence has shown that poor staffing ratios have a negative impact on both health outcomes for patients and the well-being of nurses. There have been many studies conducted about this. A recent study in Australia found that better nurse staffing in medical surgical units was linked to reduction in patient mortality rates, decreased readmissions, a decrease in missed nursing care tasks, and shortened length of hospital stays. Another study also found that a 10% increase in the number of nurses in a hospital can reduce preventable deaths by 7% for that hospital. But the overall goal in having safe assignment ratios is that nurses are able to spend the needed time with each of their patients to be able to monitor and treat their conditions. They are more likely to catch changes in patient condition and are able to provide the high quality care needed to improve patient outcomes. As far as the nurse side of it, for nurses living in a state of constant understaffing and high patient ratios has led to burnout, moral distress, compassion fatigue, and mental health disorders. This in turn has led to an increase in nurses that are leaving the profession or changing their positions and not working in a hospital setting. Therefore, there would be positive implications for patient outcomes, nurse satisfaction, and quality of healthcare with mandated safe staffing patient ratios as indicated by Senate Bill 1567. I urge you to vote in favor of this bill to improve quality of care provided to all patients in hospital settings and to decrease the nurse turnover rates and improve nurse satisfaction. Nurses work very hard to obtain their license to practice, and they shouldn't have to risk their license by providing care in unsafe staffing conditions. Without any legislation to support them currently, nurses are being forced to take unsafe staffing assignments or consider leaving the profession entirely. This is not fair to the quality of care provided to patients or to the mental health of the nurses. Thank you for taking the time to listen today. I greatly appreciate your time spent. I can be contacted for more information. My contact information will be provided in the written testimony. Thank you.